Hi guys, Sandra Ryerson here, Doctor of Audiology and owner of Adaptive Audiology Solutions in Carroll, Iowa. Today we're going to talk about tinnitus. At Adaptive Audiology, we have always been interested in caring for and treating for tinnitus, but we have never had a full-fledged program designed to treat tinnitus. And I'm excited to say that that day has now come. We now have a tinnitus treatment program for people who suffer from tinnitus. So I wanted to take some time today to discuss the condition as well as discuss what the treatment involves. Okay, so starting out with, we're going to discuss what is tinnitus. You can say tinnitus or tinnitus. Let's get that out of the way. You can pronounce it either way. And tinnitus is a sound generated inside the head that is not heard by others. So it's usually described as a hissing sound or a ringing, very commonly a ringing sound, buzzing, crickets, locusts, any kind of noise that you are hearing inside your head or your ears and that's not generated by an external source. 10 or up to 15% of the general population report suffering from or experiencing tinnitus at some point in their life, and of those, only 10% seek treatment. It's important to note that tinnitus is not a disease. It is just a symptom of an underlying condition of the auditory system. Typically, that underlying condition is noise-induced hearing loss, but there are other conditions that it can be caused by as well. For those that have been exposed to noise, the damage is done to the inner hair cells, and that damage causes the brain to overcompensate from lack of input for those cells that used to be healthy that are no longer there because they're broken off due to the damage, or they're damaged to the point that they can't respond to sound appropriately. So the brain is overcompensating from lack of input from the sensory cells it's used to hearing from. And we know that in most cases, tinnitus is caused in the auditory cortex of the brain because when the auditory nerve, the nerve that connects the inner ear to the brain, we know that when that nerve is severed, the tinnitus persists. Most often, we compare this to phantom limb syndrome, where someone loses a limb, but they still feel that limb as they feel pain from that limb, or the limb seems to itch even though it's not present anymore. This is often how we compare noise damage to the ears and how that causes tinnitus. Tinnitus can also be accompanied by extreme frustration and despair. It can be accompanied with sleeping problems, depression, anxiety, trouble concentrating, as well as some people feel that it actually interferes with their ability to communicate. Lifestyle choices and other things can also influence tinnitus, such as stress, lack of sleep, excessive use of caffeine, nicotine, alcohol, noise exposure, which kind of goes along with what I said earlier, as well as cervical or neck issues, or also grinding your teeth. So if you have TMJ or you're grinding your teeth, you'll want to definitely have that resolved, because that can often improve the perception of your tinnitus. Now that we've discussed how tinnitus occurs and what causes it, it's important to also think about why the emotional attachments that happen to tinnitus happen, and that is due to a structure in the brain called the limbic system. The limbic system is housed deep inside the brain and is responsible for attaching emotions to things. In this case, the limbic system often or almost always attaches to tinnitus the idea of stress, fear. Why is this happening to me? Am I going to die? Do I have a tumor? Is this going to last forever? All these emotions come out when we hear this noise in our head, and that is due to our limbic system. And the trouble with tinnitus is, tinnitus causes stress, stress causes more tinnitus, so it becomes a cyclical issue that one keeps influencing the other, and it's a never-ending cycle. The most important thing to know about tinnitus, once you've been evaluated by a medical professional and you've been cleared of any medical concerns, the most important thing to remember is that tinnitus, while not curable, is treatable and does not have to be an overall threat to your health. When we talk about tinnitus and how to adjust to it and live with it, we talk about the term habituation. About 90% of people with tinnitus habituate naturally. We all habituate to benign stimuli in our environment. For instance, wearing a watch. We might feel that watch at first, but we learn to get used to it and we start to hardly notice it. However, when we have a novel stimulus that we consider a threat, that habituation does not happen. So the goal of tinnitus treatment is to prevent tinnitus from negatively influencing someone's quality of life. We want to reverse that overcompensation that the brain is doing in the auditory system that's causing this tinnitus. So that overcompensation of the brain that's not hearing from those hair cells anymore in the inner ear. We also want to identify and change negative thoughts or behaviors related to the tinnitus. How do we start? Well, typically you either start with your primary healthcare provider, they evaluate you and find nothing concerning, so then they send you on to an audiologist for a diagnostic hearing test, or sometimes it's the other way around. The diagnostic hearing test is done first, and then if the audiologist feels necessary, the patient is sent to their primary care provider, or sometimes the ear, nose, and throat provider. For those that have hearing loss and tinnitus, about 60% of those people will find improvement in their tinnitus just through wearing hearing aids. If after amplification, those that are still finding tinnitus to bother them, then we bring in habituation strategies using sound therapy inside the hearing aid as well. And this is something that has been tried in different ways in the past, and we're excited for what we're able to offer now as a new solution for this. We also, for some people, they don't have hearing loss or just barely have hearing loss, a sound generating device at the ear level is something we may still consider, but we may also just consider strategies for sleep, strategies for cognitive behavioral therapy regarding how can they restructure and reframe the way they view their tinnitus, and just understanding, a lot of times just understanding why this is happening and really diving deep into what's going on. You can really find that people feel more in control of their tinnitus, and this already reduces the stress and anxiety associated with the condition. For some people, even relaxation techniques can be very useful because it helps reduce the stress, which then again helps with the tinnitus. At times, the stress and the depression, the mental health of the patient is significant enough that a referral is necessary prior to dealing with the tinnitus. So that's always something we consider, because we know, and Dr. Richard Tyler at University of Iowa, he says, we don't have a medication to treat tinnitus, but we do have medications to treat anxiety and depression, and those are good things. And so if the tinnitus has gotten to that point, sometimes that's the first step we need to take. So every person's going to be different with the method we take. And what I recommend is that you go talk to your physician and then come in to us at Adaptive Audiology Solutions. If you have any other questions, comment below. If you like what you've seen here, subscribe, hit the bell button at the bottom so that when we post a new video, you're alerted to that. We want to thank you so much for taking the time to learn more today about tinnitus, and we wish you well, stay safe out there, and have a great day.